who's okay on monitoring anesthesia right now? 1, 2, like 4 people, 5 people. Dr. Romano raised his hand. You haven't taken the test yet, Dr. Romano.
It's true.
Officially. So obviously the goal of anesthesia is to render our patients unconscious enough to do surgical things and to do painful things to them, but not so unconscious that they're dead. Okay, so that's our goal. Right?
To have them wake up. Right.
Yes, of course. So what we're going to do is that we're going to go through basically how to set up the anesthesia machine and how the gas and the oxygen are delivered to the patient, because that is extremely important in knowing the basics of how this machine works and how you can troubleshoot it if there's a problem. So if you can't set up this machine properly, you cannot monitor anesthesia, because crap happens and you need to be able to immediately assess the problem, because this is how the animal is breathing, this is how they're staying alive, and this is also how you can kill them. So we'll go over the rebreathing system first, and then we'll go over, is that how it is in the notes?
Mm-hmm.
Rebreathing. Okay, we'll go over the rebreathing, the advantages of both of them, of each, and then the disadvantages. So, honey. Is this in the oxygen going to this one?
It's on the other one.
I think that one's better.
Okay, so obviously the oxygen starts off in there, or it's on this E-tank. So we're going to follow the oxygen, and we're going to discuss how that works. So the oxygen comes into the machine, and then it's going to enter into the vaporizer, then it's going to exit the vaporizer. Does everyone know what the vaporizer is? Okay.
What?
So this is the vaporizer. This actually is what delivers the anesthetic gas to the patient. So if it is on off, then the patient is just getting oxygen. And as we push this number and dial it, this is the percentage of gas that the pet gets. So in general, even though it says off, they are still getting gas. So this is why we don't use this as a flow by oxygen for patients, because there's still residual gas in there, and for ill pets that we're triaging or whatever, this is not the way we would deliver oxygen. Okay? So oxygen comes into the machine, into the inlet valve of the vaporizer, then it goes to the outlet valve of the vaporizer. You see I've got this cord here. And so this is called the Y piece. So the oxygen comes in, the patient breathes in, then the patient breathes out, and oxygen and gas go into this bag. It actually goes into the CO2, then it comes back into here, and we rebreathe it. This is called the pop-off valve. You see it's taped here. This always remains in the open position. We're not going to talk about the ventilator. So this is always in the open position, and this is called the pop-off occlusion valve. So this is a safety valve that we use to deliver a breath to the patient. So, and then this would go to the scavenger. And there's notes in there about it. This is a safety valve. So again, oxygen comes in, into the vaporizer, out of the vaporizer, they breathe in, they breathe out, the CO2 is reabsorbed, then they rebreathe. So this is for patients that are 15 pounds and over, right, this system. And then we have actually 2 different Y pieces. You guys see this? Mm-hmm. So this, I guess we typically use, this is called the small Y piece, this is called the big Y piece. So this one we're going to use for between 15 and 20 pounds. Is that right, Joyce? So, do you guys see the difference between these 2 tubes? What's the difference? One's longer and bigger, right? And so what is that? What is that in there? We call that dead space. That's right. And so we're going to talk a little bit more about dead space in a second. So the reason this is for bigger pets, this is for bigger than this, is because we don't like dead space. Dead space is basically dead air that they have to move back and forth in order to get oxygen and gas. So either they are not going to go to sleep or they are not even going to get oxygen and die. So we don't like dead space. So we want to like choose the right circuit for the right size pet. And all of these are based on lean body weight. So if you've got a morbidly obese 20-pound dog that should be 12, you're not going to use either one of these. You're going to use the other circuit. Does that make sense? Mm-hmm. So the other thing that this machine, the negative of this machine is that there's also, with each one of these points, there is resistance. So we have this mechanical resistance where all these little valves that are here, they have to breathe against this stuff. So when they breathe against that, that's difficult. You got a tiny little cat, tiny little dog trying to breathe against that. That's going to make it much more difficult. Do we want to make it difficult for our pets to breathe? No, we do not. So, so again, 15 pounds and over. 15 to 20 pounds. And there's a little nuance to these things, and we sometimes have to tinker with it a little bit. But usually we have somebody, I don't think we have enough time to get everyone to go through the circuit like we usually do. We might choose someone. Where's Brianna, our newest person? We're gonna let you shine today because we usually have every single person go through the circuit, but we do not have time for that today. So Brianna, you can do it. Rebreathing system. Let's go.
You can do it. Okay, girl.
Sorry, I'm gonna get all up in your business for a second here.
Do like Vanna White, yes.
Okay, so the oxygen goes into the vaporizer. Excuse me.
I'm sorry.
Mixes with the gas. Comes up vaporizer. Okay, comes out the vaporizer. The pet brings it in. And it breaks out.
Removes the CO2.
Removes the CO2. Then they goes into the bag. And then they rebreathe it. Like a scavenger.
Right. Very good. So, I guess I should show the circuit test.
I got a question. What is this little bag called? Is this a bag?
This is called the rebreathing bag.
Okay.
So I'm actually going to test the circuit right now. I need like another hand. This was the beginning of the pop-off occlusion saga of 2016. Okay, this is how you actually check the circuit. So you see as Ryan is pushing this closed, I should have gone over that earlier. So basically this circuit is, something is leaking, but we're going to just say it's okay for now. So you see how this bag is taut, it's holding pressure. So do you see how with Ryan, if this pop-off valve were closed, what would happen if this pet tried to breathe?
Lungs would blow out. The air would just keep
Their
going.
lungs would explode, and then we would be very sad. So they cannot breathe if this is closed. So that's why we have this beautiful safety valve to prevent them from that ever happening. So you're going to test that. This is how you do it, the circuit check. So then the other thing the other advantage of this is that it conserves gas, heat, and moisture. I forgot to say that. So the advantages of this circuit are that it conserves gas, heat, and moisture, which is great, which would be lovely for our small patients, but they can't breathe against this machine enough to utilize that. So another reason why we'll talk about conserving heat later. So the disadvantages are increased dead space, increased mechanical resistance. Did I forget anything else? Okay, now we're going to do the non-rebreathing circuit. So
how do you know what size bag to use? Because I know we have different sizes.
It's in the notes. We used to calculate it, but it's really just on there now. I have it in your reference notes. Sorry, but really it's kind of like small, medium, large, small dog, medium dog, large dog, Okay, so I'm taking this thing off. Where did my cat go? So does anyone think that this thing should ever be left open? If we follow the circuit, What would happen if we left this open and we connected this machine to an animal? If we're following the gas, right, where would the gas be going? Right here, right? Right here. So just into the room, not into the pet, so then they would die. So now for the non-rebreathing circuit, we're going to do this. And this is how we do it. And we're going to follow the gas. Oxygen comes into the machine. Always the same. It goes into the vaporizer. The oxygen mixes with the gas, and on this here, it goes directly to the patient. So this, if you start fussing with this on a non-rebreathing circuit, you're messing with the wrong thing because this is totally like, you don't need this part. So, again, oxygen comes into the machine, into the vaporizer, mixes with the gas, directly to the patient. So this needs a higher flow rate, a little bit higher flow rate, and there's very minimal rebreathing of gases with this. And so advantage of this would be what, Sydney?
Wait, what? I was writing.
Brianna, what's an advantage of this circuit? We're going to use this for 15 pounds or less. What do we? The advantages and the disadvantages of each circuit are opposite. So if it, right, dead space. Where's the dead space on this? Where is it? Does anybody see it? It's on your endotracheal tube. That's it. Like the end of the, so basically between what the pen is connected to and this. Less dead space. Where's the resistance? Where are the valves? Anybody see a valve here? Mm-hmm. Yeah, so that's pretty simple. This one's pretty simple, right? So what do you think the disadvantages are? Right, so we just said earlier that the other one conserves moisture, heat, and gas. Well, this one can't because the flow rate is just going out. It's just going into the scavenger. But we have, there are trade-offs in anesthesia. We have to have less dead space, or we can't keep them under anesthesia. So, and the other thing, the advantage is that you can change the concentration of gas very quickly with this machine because there is less dead space. So, in this machine, you got all this to work with before you can change the concentration, right? So, that's the advantage of this. All right. Joyce, I'll just pick on you since you're just close enough to come up here. Would you like to trace the circuit for us? And we'll do a quick leak check. I know everyone thinks this is silly, but this is what you should be doing every time something weird happens. You should check this circuit immediately with your brain and your eyes and your hands. I mean, shit goes wrong. You don't know how it got weird.
Edit that part, Ryan.
That's hard for the younger viewers. Okay, oxygen comes through the machine into the vaporizer, mixes with the gas, out through the port here, into the pet. Breathe. This goes to the scavenger.
And now it goes into the basement.
Now it goes into wherever. Yes, it goes.
Just into the basement.
Yes, and you check it by, this is your pop-off valve on here. So when you go to check it, you have this, and you can turn your gas on, and you can kind of see if you have any leaks. There's a leak somewhere.
It's that. Yeah, both of those bags are leaking a little bit.
So when y'all say leak, you mean like if there's
We're trying to see if this thing holds pressure. Okay, so Joyce, check the circuit. So here we go. We're gonna check. Joyce is gonna be like, okay, Ryan set this machine up for Joyce, and she said she did it, and I'm not thinking it like right. So Joyce is gonna check the circuit because she's in charge of this pet.
So I'm checking it.
Joyce is gonna check the circuit. She's holding the end off.
Pop off valve.
Oh, what happened?
My bag's not going. I'm like, oh man, mine was leaking. And I was like, okay, I got this is off.
This is what we call it leak check. This is why we check the circuit every single time.
Goes to the bag. It does this out.
Does that make sense to everybody why we do that? Because if this circuit is complete, then you should be able to fill up this bag. If it's not complete, somewhere, this thing can come off too. I won't do it because it's actually really tight on there.
This thing can come off too?
Everything can come off. Everything can come off. These cords these tubes can disintegrate. That's happened. So, all right.
Ice the cap off.
If
Yeah,
the
oh, yeah.
stuff
Yes,
on it
any of
is
this stuff, if
properly-
anything is open, it will not hold pressure. So all
also-
of that things is a safety mechanism.
It's really important, like in the middle of the procedure, especially something like a dental where you're flipping the patient. It happens all the time. So we flip them, and then 10 minutes later, you realize they're starting to get light and can't figure it out. A lot of
Always
times,
check the circuit.
something came loose, or your doctor is not really paying too much attention. It's not even connected to the ET tube anymore.
Yes.
Got it.
That is the rule of choice. I mean, what do we say? If something's going wrong, the first thing you do, other than to assess whether or not your pet is alive, is to check the circuit, because that is 80% of the time the issue is that somebody forgot something. There's also, you've got a lot of things connected. You got the CO2, and there's stuff. Used to be the cricket, things can become unattached. All right, so next thing is this outline. Okay, we're gonna go quickly through pre-anesthetic blood work. I'll just say the reason we do pre-anesthetic blood work is we want to try to make sure it's safe for pets to go under anesthesia. We're gonna check their liver values, their kidney values. We're gonna make sure that they're not anemic. There are reasons why we might postpone a procedure. There's also things that we might need to do prior to anesthesia, like if the cat has kidney disease or a dog has kidney disease, we would want to put them on fluids prior to anesthesia. So it's mandatory for all anesthetic procedures here. We don't discuss it. It's just mandatory. IV catheters, also mandatory for general anesthesia. That is to have immediate IV access. To give the induction drugs, pre-meds, to give fluids during anesthesia, et cetera, et cetera. I mean, this may seem nuanced to you guys, but there are definitely places that don't require IV catheters. But the thing I wanted to say is that we want it to be low stress, and so we get pre-meds and all kinds of other things. So low stress is the key, because the more stressful that the pre-anesthetic period is, the more stressful and the poorer your anesthesia will be, and also the poorer your recovery will be. So low stress in general is important for this time. Fluids, every pet gets on fluids. They all should be warmed. So we're gonna do our best to get in the habit of plugging up that fluid warmer for every single procedure. That is not mandated by me. That is mandated by AHA and the AAFP. It doesn't, that is part of the guidelines. Is that there is absolutely no reason, even if a pet's temperature is mildly elevated, there's no reason why they should not receive warm fluids. It's not like those fluids are higher than body temperature. It's only 102 degrees. So we're not going to heat them up with the fluids. We're just going to maintain their body temperature. Okay, so we have some. I always say that. Easy math is safe math. So we have some easy calculations that we can do for fluids. So for maintenance fluids,
I'm so sorry.
we go 1 mil per pound per hour. It's pretty darn close to the actual calculated fluid. So that way, obviously some people do calculate it, but that's a good way that you can double check your doctor where you guys are in the same ballpark. If your doctor says maintenance, and they tell you to put it on 170, and it's a 20-pound dog, maybe you should, maybe you guys should chat. It's a way for everyone to be safe. Safe math, easy math is safe math. And so if somebody says you're going to be twice maintenance, Joyce, for a 10-pound dog, what's twice maintenance?
2 meals.
Right, 20 mils an hour is pretty easy. So everyone should be, the whole goal is for us to work as a team and check each other. So, and then the anesthesia, so we've got the rates here for cat, 3 mils per kg per hour, and dogs is 5 mils per kg, and that also is from the 2011 AHA Fluid Management Guidelines. Okay, and then as you see right there, there's the rebreathing size, Amanda.
Mm-hmm.
Right here, the reservoir bag, or rebreathing bag.
Mm-hmm.
Okay, and then induction. Does everybody know what induction means?
What?
So induction so that is after we've given our pre-med, usually the catheter is in, and we're ready to give the fast acting drug that is going to like put them into an unconscious state, or we can intubate them, or we can put in the endotracheal tube. So that this is a critical time, because the two most common times where pets die under anesthesia is induction and recovery. So this is a critical time. We want to make sure that we have all of our ducks in a row. That's why we have the anesthesia checklist, to make sure that everything is ready ahead of time. So we are going to try to pre-oxygenate that pet. That way that they are very well oxygenated when we are trying to intubate them, because during that time when we give that anesthetic drug, usually those pets stop breathing. And so when they stop breathing, are they getting oxygen? So we want to raise their oxygen level as high as we can before we allow that oxygen to drop. So if they're already kind of compromised, and then sometimes we can get into trouble just in that amount of time that we need to put that tube in. And sometimes not everybody is as easy to intubate as others. So we're going to try to pre-oxygenate, ideally with a mask. That most of the time does not work as well, but at least we're going to do flow-by. And if we do the flow-by, it needs to be greater than 6 liters, which is a pretty high flow rate. It needs to be pretty close to the pet's nose in order for them to actually get the oxygen. And also you can do that while you're intubating.
So how do we know with the oxygen, like you know how it goes to 5 on the
Flow.
the flow? How do we know what number to put it on? Because I know normally like sometimes we keep it at 2. But
So 2 is pretty standard for when we're doing just like sedated procedures. But a lot of times it really is going to depend on how close you can get that to that pet's face. So obviously, if you've got a really anxious animal that's not going to allow something very close, you're going to have the flow rate higher. You know, a little bit of it's subjective, and I think you may have to defer to the doctor that you're working with. But in general, we'll backtrack a tiny bit. If you're sedating a pet, the standard is supposed to be, and hopefully we can try to do that, is that pet gets eye lubricant, heat, and oxygen if it is available. And, you know, obviously there's not every pet's going to get that, but you should have that in mind when your doctor says we're going to sedate a pet. What are we going to do? We're going to lubricate the eyes, we're going to provide a heat source, and we're going to provide oxygen. And then obviously you're going to do your monitoring and all that other stuff, but the goal is that, you know, what is that stuff going to hurt? Has anybody ever been hurt by eye lube? Usually not. You know, those are things that can be extremely helpful, and it's better to have it and not need it than need it and not have it, and be trying to put crap together and find stuff and get it untangled from the drawer when you really need it. So, okay, so we're going to pre-oxygenate. And then I wanted to remind this little thing is that the greatest loss of body temperature is during the first 20 minutes of anesthesia. When they go under anesthesia, their like thermoregulatory system is completely discombobulated, and they precipitously drop their body temperature. So it's extremely important to start warming them even when they're just got their gabapentine. But when they get on this table, we should be thinking about warming them. Obviously, we want to think about keeping them alive too, but it should already be on your mind. You should have that bear hugger ready. If they're small enough, you can already have them covered. You can put EKG leads on underneath the blanket. It is possible. Just so everyone knows, it is possible. But it's so much easier to keep that body temperature than to let it drop and try to get it back. I don't know if anyone that would disagrees with that. Like, it's pretty hard to get the temperature to come back up after it goes down. It can be done, but the goal is to not let it happen. Let's see. We're going to intubation. Allie wanted me to remind everyone that we should be lubricating the endotracheal tubes. And I looked it up. That is actually part of the anesthesia guidelines, at least for cats. So it does help make a secure seal of the endotracheal tube. So Allie has been talking about this for years. I agree, Allie. We're gonna try to get in the habit. It is a hard habit.
Be sure when you do that, you're
Just
just doing
the
on
cup.
gluten. You don't like dip it in like this and create like a little plug inside.
Yes, that is true.
Don't, yeah.
So Allie is right. I'm sorry
Don't
that
get
we
it on
have.
the keyhole.
Yeah.
It's just a little bit, but still.
Thank you.
Okay. So we've talked about this a little bit before. I think I've talked about this with everyone. So cats in particular have very, very, very sensitive trachea. So cat trachea is a complete circle, right? A dog trachea is basically has a half cartilage and then a dorsal ligament. So when we're manipulating cats in particular, there's only a little room for error when we're moving that cat, when we're intubating that cat, and so we have to be extremely gentle. So again, from the anesthesia guidelines, you should never use anything larger than a 3 ml syringe to inflate the cup of a cat. I know that you can, everyone could probably do it with a 20 ml syringe, but there have been actually multiple studies done is that the use of larger syringes is not recommended because it is so easy to overinflate the cup. So in dogs, they recommend not using anything over a 6. I think that, sometimes if I were inflating like a 13 tube, it might take a while. But anyway, especially for cats, we need to be extremely careful. And when we're actually inflating the cup, we're inflating it just enough till we have a seal. We don't inflate it till the bulb is squishy. That means absolutely nothing. So that is a completely subjective thing. So when we inflate the cup, we inflate it a half a cc of air at a time or a half a ml of air at a time, and then we check for leaks. Does that make sense to everybody? Squeezing the little bulb doesn't mean anything like that. Like I feel like that is. I'm not talking about here, like in general, like it's in all of the papers because I think that it's somehow, somewhere, someone said that and people just keep adhering to that if it's squishy, then it's inflated. That's not true. Okay. We're always going to disconnect. We need to be careful with the tube, dogs and cats, and we always disconnect anytime we move a pet. Anytime we do anything with their head, we're going to disconnect. Okay? All right. And then I have a pop-off thing. People that deal with the ventilator is a little bit different, but when in doubt, pop-off valve is open. Okay. Now we're going to talk about monitoring things. So we have a lot of equipment to monitor the patients, and we're going to go through each of them quickly to see kind of what they're measuring and what they represent when they're high, low, whatever. We're not going to get into super specific numbers of like what heart rate is okay and what this or that. It's just we're going to talk about very the generalities of anesthesia. So the pulse oximeter. Does everybody know what that looks like? This is the probe. So this is the pulse oximeter. It measures the oxygen saturation of the pet. So that basically, it also has a heart rate on there. And what that really measures is what we're going to say is an indirect measurement of how well that pet is ventilating. So if a pet is not ventilating or if it's not breathing well, then the pulse oximeter, the pulse ox is going to slowly drop. And so, in general, as the numbers drop, that usually means that they are getting deeper under anesthesia. So when you're deep means asleep, and deeper, a sleeper. So the deeper they are, the less they breathe, the lower their heart rate, the lower their blood pressure, the lower their body temperature, right? So as they get deeper, closer to death, the numbers start to drop. As they get lighter or awaker, the numbers start to go up. Does that make sense to everybody? So the pulse ox can be a little tricky, so definitely don't go down the rabbit hole trying to fuss with the pulse ox. We have other monitoring parameters, but it can be very helpful. But it measures the saturation of hemoglobin, on the oxygen molecule, but really it's how well is that pet ventilating. Okay. Blood pressure. We're going to use the Doppler. That's what we use. We don't even think we have. I don't know if any of those other things work. So the Doppler is the most accurate way to measure blood pressure. The Doppler is just a fancy listening device. So all it does is listen. All you do is use that to hear the heart. Everyone can hear it when they're, you guys have all heard it. And then, sort of more importantly, the sphygmomanometer is what we're going to do to measure the blood pressure. And also the choice of the cuff is important. We have a blood pressure cuff somewhere.
Can you spell sphygmomanometer?
No, I cannot.
Yes, it's right over here. It's right down here.
The squeezy thing. Okay, there we go.
Commonly referred to as the spit.
This is the sphygmomanometer. This is the blood pressure cuff. So when you're looking at this blood pressure cuff, the choice of size is important because I can make a pet's blood pressure do all kind of crazy things by choosing the cuff. So this should be 40% of the circumference of the pet's leg, right? So this would not be an appropriate size for me. I should have put a picture in that thing.
What would be 40%?
This, so basically like if this is a cat's leg, if you were going to go around, it should be about 40%. So it's this diameter here, not the length.
Okay.
So the other thing that's important is that this tube needs to be on the inside, the medial side, inside of the leg. That's where the artery is. And so you want, if you're trying to measure the blood pressure, like you need this, it inflates here first, and so that's where you want it to occlude and stop the sound. So if it's flipped around on the outside, it actually alters the blood pressure quite a bit. I've done that in the room quite a few times when I'm monitoring, when I check pets' blood pressure. So it is important. The size and the positioning of the cuff actually is quite important. So it's a little tricky. The learning curve is slightly steep, but once you get it, it's actually quite easy to use the Doppler. I feel like so. Does everybody get that, hopefully? So, in general, same thing with the numbers games. As pets get deeper, the numbers get lower. As pets get lighter, they get higher. So getting sometimes it'd be nice if we had all the parameters that were awake, but they don't usually get that. But the blood pressure is one of the, we don't go down the rabbit hole, as we say, down with one number. We're not going to freak out over the pulse ox. We're not going to freak out over the heart rate. But the blood pressure probably is the most important of any of our monitoring parameters, is that's one of the ones that is going to excite more action, especially if it's low. We want to do, because that is how the blood is getting to our vital organs and our brain, and so we don't want that to be too low for too long. So that one is probably one of the ones that if it starts to get low, you should be doing stuff to try to change things. What would you do, Joyce? Turn down the gas. That's right. Turn down the gas. When in doubt, turn it down.